All right. Good evening to our viewers. Thank you for tuning into this. Um, Very important during this time, and I hope you'll be able to get quite a lot from what we discussed today, because this is coming from a perspective that we haven't actually had the chance to get, and I'm really excited that you're getting this view from people who have experienced what it's like to have COVID-19 and to be in contact maybe with someone who has had this particular condition. So before we get started, before I introduce my guests, I'll just like to highlight, some of the key pointers. As it stands today, we're looking at 600,000 deaths caused by the COVID-19, but to note, we have over 9 million recoveries from the COVID-19 worldwide, right? And it affected over 15 million, over 15 million people globally. But we have over 9 million recoveries, which is very good news. But we rarely speak about the good news. We speak about the deaths. And bringing it closer to home in the context of Zimbabwe, right now we're looking at about close to 2,300 cases. We're looking at about 2,296 cases of confirmed cases, and 514 recoveries and 32 deaths. So it has really come into our doorsteps, and we really wary of this particular condition, which is why it's important to wear our masks and to sanitize. All right, so without taking too much more of your time, I'd like to introduce my guests today, and we have a very good friend of mine, and I like to call her my mentor as well, because she's taught me quite a lot when it comes to mental health. And we have a very special guest this evening. Let them introduce themselves so that you know exactly who we are with. So we'll start with you, Tali.
Hi, Tino. My name is Teresa. I'm a clinical psychologist based here in Harare, and I'm the one who was in quarantine. Yeah.
Right. Thank you, Tari. Good, doctor?
Okay. Good evening, everybody. My name is Dr. Sacrifice Teresa. I'm a medical doctor. I'm a specialist psychiatrist, and I think I'm here because over the past few weeks, I've been a COVID patient and went through through the process, got ill, and so we hope we will have good discussions that will help so many people.
Great, thank you so much, doctor, for that, and thank you for sharing this. Because look, I think as people view this and see how you are looking great and you've recovered, we may be able to remove or reduce the stigma that is now starting to be associated with COVID-19. Really appreciate you taking your time and actually sharing with as many people your experience. All right, so let's get into it. You have mentioned that you were a patient, and I think the people would like to know, how are you feeling?
I'm definitely feeling much better. It's with COVID, the recovery is a bit long for some of us because of our age and underlying conditions. You still feel a bit weak, so I'm still at home just trying to regain my strength. But compared to how I was and how I was feeling few weeks back, when I was in the bed and with all the symptoms, very symptomatic, I'm definitely much better, and I'm feeling better. My strength has come back, and that's why I'm even able to do this interview. When I got started, some people said, can we do an interview with you? I was just too sick and too toxic even to talk on camera. And I had to get a shave today. I've got my COVID look, and so I just thought maybe since I was going to come live and I'd just be more presentable, because it was something else.
It was an experience, yeah. But it's great to see you in good spirits and doing okay. Some people want to compare COVID-19 with the general flu that we face, that people have. Would you say there's any similarities, or is this a totally different beast altogether?
Look, there are some symptoms which are similar. But the truth to me, with my own experience, was COVID was an upgraded level. It was a 10x flu. It was the symptoms that I experienced, the level of fever that I experienced. I'd never experienced that before. I'm usually a person with a lot of energy, but this one got me down. I was actually in bed several days, not even moving, not even eating. The fever is quite terrible. I felt as if my body was bent, as if I was plugged to electricity. I even had an electric blanket and everything, but it couldn't keep me warm. I'd never felt anything like that. I took the antipyretics, the paracetamols. I took the stop pains. I took everything that anybody can take. I was anything that anybody suggested. I was taking. That's how bad it is, and I'd never had such a flu. So, for people to say that it's just a flu, I think it's not right. It definitely has got some flu symptoms, but to those who are going to experience the moderate and the severe, this is not a flu. This is bad news. This is bad news. I'm telling you.
Wow. No, yeah. You called it a 10x flu, yeah. So it must have been one hell of an experience. I just want to bring Terry into this, Terry. From the perspective of someone who was under quarantine, and you've heard how the good doctor has described his symptoms and all that. When you were hearing all this, because the news would definitely highlight some of these issues, how did you keep your spirits up during your time in quarantine?
Okay, I guess I was lucky because I have tools with me, but it was a difficult time. So I had to go into quarantine because I'd worked with Dr. Chirisa in the previous week. And when he got his results, he notified everyone he had worked with. So I suppose the first thing that then happened was the shock, obviously, when I got the message. And before knowing my whether or not I was positive as well, it was really difficult. I mean, I could have been in shock for a whole day. Wow. So I got the message on a Sunday, and I just said to myself, the next Monday I had to get a test done because it was quite difficult. Mm-hmm. So having the test done helped because the results were negative. Mm-hmm. And then what kept my spirits high, I suppose, going back to my tools, I did 4 things very consistently. So I kept my schedule. I worked. I did something that gave me a sense of achievement every day. If it was getting out of bed, and going about my day, but doing something that gave me a sense of achievement. And then I was very active. I had to do a physical activity every day. So I skipped every day. And I guess subconsciously I was telling myself that as long as I can skip and I can do at least 500 or more, I'm fine. So that kept me going. I tried to socialize, staying in touch with my sisters, because my sister also tested positive and she's in England. She's fine now, but she's gone through the experience. So we kept in touch and we talked almost every day. And then I also tried to do something pleasurable every day. So went back to my soppies, just watching things that made me laugh. But having a negative result didn't mean that I didn't have COVID. And when the City of Harare people came to start the monitoring, they had to remind me that didn't mean anything. So every day you wake up thinking, oh my God, is this it? Do I have it? So you keep checking the symptoms, and that, I must say, disturbed my sleep. I'd wake up sometimes and check if I had a dry throat or, So it was quite difficult, but I kept doing those 4 things every day.
Wow, great. I hope those who are watching will also take this into consideration, especially since it's coming from a psychologist as well. I mean, we really need to take this advice well. But I'd like to give you the floor, Terry, maybe to ask, because you experienced this, and from a mental health perspective, you'd probably have one or two questions you want to throw to Dr. Chirisa and maybe find out and on a mental health perspective, how the experience was and what sort of advice we can dish out to people.
Yeah. I obviously had it easier because of the negative result, but I can imagine what went through Dr. Chirisa's mind during this whole period. And Dr. Chirisa, I would just like to know your experience emotionally. What was the first thing that came into your mind when you heard that you were positive?
Yeah, definitely the result created a psychological storm. Being a leader of doctors at that time, before I resigned as the Secretary General for Zima, and being a senior official in the Ministry of Health, and probably being the first one who got affected, it was a difficult time. One of the questions that I asked was, why me? Why should I be the first one? And there are people that are actually working in more riskier spaces, and they were not. And so it really hit me. But one of the things that had happened is that I'd been ill for about a week. So I was kind of like thinking, this flu. So that's actually what got me to get tested. I said, look, I think let me go and get tested, because this is not a flu. So there was one mind which was expecting a positive result because of the level of toxicity and illness that I was having. But obviously, just being told that you have it, and you are a medical doctor, you've got underlying conditions, hypertension, you've got age on your side, advanced age, not too young, but I'm 45 now. And so, so that got me to think, and I was really ill. I knew that people would have mild symptoms, a few days, 3 days, but I had now been ill for over a week, and I was now in bed, and I had some time in bed. So I was definitely not the mild. I was probably in the moderate to not severe, but and also the time. So that got me had a lot of thinking. And to be honest, the thing that I feared the most was to die. I feared to die. This thing does not have any cure. This thing, I talked to my friends all around the world. They sent me what they thought from New York, from UK, from South Africa, around. They sent me what they were doing, but you could see that there is no cure. And there you are suffering, and it's now more than 14 days, and you are bedridden. You can't come out of bed. There's no way. You cannot stop to think that, look, this might go south. And that was my greatest fear, and that was my greatest. And there were days, I still remember at least 3 days, where I'm a devout Christian, I'm a pastor. I did not pray. I did not read the Bible. I did not sing. I was just quiet to myself. I didn't want anybody. I didn't want any calls. And what came into my mind was, is this it? Is this the end of my life? And, as the symptoms got worse, I was saying, yo, this thing is getting serious. This thing is getting serious. And so there was a lot of anxiety, difficult in sleeping. I would wake up in the middle of the night. I'll be weak. but I would just be awake, and I'll be thinking, what will happen to my kids? What will happen to my family? Worse still, when we then tested, and one of my last born, who is been 7 years, also was positive. You know, that gives you a scare, you know, and say, look, this thing is here, and there's really, and when we looked at I started to look at my friends who are leaders in hospitals and said, look, guys, if I get serious, where will I go? That was the first thing. So I was looking and say, if I need intubation, who is going to intubate me? Who is going to? So I was planning, you know, the worst case scenario, but it was so difficult because at that time there were very few places in country that had the capacity to then take and a person who then got serious. And I was in the middle of the park, and the situation was increasing. And I was really saying that if I really need to be intubated or to be in ICU, I'll probably die. And that was so my greatest fear during this was this fear of death and what will happen to my. I didn't think about my career. I didn't think about my cars. I didn't think about anything. All those things. I think for the first time in my life, I never thought about all those other things. I was just thinking, is this the end of me? And what will happen to my kids and my family? Those are the things that were hammering my mind all the time.
All right. And looking at the severity of what you went through, especially psychologically and all that, maybe to both of you. So, would you say it's essential that people get some kind of therapy or counseling services after the experience, or even after the quarantine experience as well, like in the case of Tari? So, would you say it's very important to also get that kind of professional help because of this experience?
Yeah, I think it's very important to have mental health help. Because for me, like I said, I didn't have any symptoms. I was okay physically, but emotionally I was struggling. So you could say that might as well have gone through the grief process. I thought about, the things that I could have done well on that day. I was angry at myself for not sanitizing. I was angry at myself for doing certain things that I normally don't do. So you start replaying the day and you look at all the things that you did wrong. And at some point you get angry at yourself. And I also struggled with possibly what Dr. Chivisa struggled with, the fact that you put your family at risk. So obviously you don't choose to be in certain situations. You don't even choose to be exposed to COVID-19. But as a parent, if it happens and you're at home with the children, it hits you really hard. So I think mental health is important. Equally important, we should have counseling before the test, counseling after the test. And I think we should have continued support even after, you recover.
Yeah, I actually totally agree with you, Tari. A lot of people right now who are suffering from home, they've got a lot of anxiety. Today, I got a call from one of the government doctors who got tested and was positive. The guy was well, and he said that when I was given my result, I immediately became ill. He said I then went into the blankets and I started to feel things that I was not feeling few minutes before. Then obviously that's an acute anxiety attack. So one of the things that is key is COVID infection, or whether you are in isolation, whether you're in quarantine, whether you are not infected yet, or whether you are going to be infected, there is a strong psychosocial and psychological component which people you have to deal with. Now, especially when you become positive. I think it's important for people to organize, that support that they need to have. I think everybody does. I needed support. I'm a psychiatrist. I've been working in the mental health space for years. I've helped so many people. But when it hit me, I cannot cancel myself. I needed somebody to talk to. And I got a lot of help. I reached out. So a lot of people have got nobody to reach out. They have got no platform to reach out. And they are scared of reaching out. But it is important for you, because if you keep it all in your head, you will explode. And there's that ventilation that is needed to calm you down, and also to interact with other people that have gone through. That's why we came out. It was not easy, because you can suffer stigma. Patients may not want to come and see me, but it's a risk that I took and said, look, let me come out. Let me help somebody who is out there, who does not have the boldness to come and say, you know what, it's okay what you are feeling. It's normal. You are not going crazy. It's a normal human behavior when you are faced with such a situation. But I wanted to bring out and say, look, we can do better in our response as companies, as families, as churches, as a nation, to support the people that are going through, instead of segregating them, instead of stigmatizing them. Even those who are running away from quarantine, it's fear. They need social support, they need psychological support, and it's a very critical component as you go through the condition, as even as you recover, even post recovery. People, when after I recovered, I went to a certain place, and all the people were standing far away from me. Hey, and so people need to be taught. People need to be out there, and we need to have that human first, and to understand that, look, today it was me, tomorrow is going to be you, tomorrow is going to be your brother, and we need to take care of one another, especially the psychosocial aspect.
That's great. All right. No, thank you for that, Dr. Chirisa. And I'm looking at the time and thinking, wow, where has the time gone? And I had limited our discussion to just 30 minutes. I think I should have given it a lot more time. But I do appreciate the input you've given, and I'm sure all our viewers are going to really appreciate what you've shared with us, and what we need to do as a nation, especially coming from you as a leader within the medical field. I think it's essential that we get to tap into your input as well. And Tari, I don't know if you could just share one or two things in closing before we end our discussion.
Okay, no, just to say thank you to Dr. Chirisa for coming out. I mean, this must have been very difficult for you. Thank you for doing this, and I hope people have learned from this discussion. If you have any questions, please feel free to ask. We'll be happy to come back and do another show. And just to say that the stigma is real. Let's take care of each other. And remember the essentials: sanitize, wear your mask, social distancing, physical distancing, and stay connected.
Yeah, great. Thank you for that, Terry. And we called this discussion today, I think COVID-19, we're all in this together. And you have actually shown that there is a need for us to actually work together and share as much information as possible. Thank you so much, Terry, for being on today. And thank you so much, Dr. Chirisa. We're glad to see you recovered, and we would want to see you out there sharing more information soon. Thank you to both of you. You have a good evening.
Thank you. Enjoy the rest of the evening.
Thank you. Bye.
All right, guys. Thank you.
All right. Thank you. Cheers. Bye.
All right.